Hi, my name is Dr. Ross Hauser. Welcome to Caring Medical Florida. I'm going to present a case here. It's one of our patients that came over from Europe. And the case is just going to illustrate how important the cervical curve is. Some people do have a lot of instability, but honestly, there's a lot of people where the bad curve or the destruction of the cervical curve is as much of a problem as anything. This particular patient, interestingly, her symptoms started basically on an airplane in about 2 years ago. She was flying, and whether it was the turbulence in the air or something, but basically after that, she had terrible tinnitus. Her head felt like it was in a vice. She continually had nasal stuffiness, and then she was really, really sensitive to light. So I'm going to now present, her a part of her digital motion X-ray. We see in her still here, so it's just a lateral view of her cervical spine. We see just how terrible the curve is. Now, most people, their curve is supposed to be a C. It's supposed to be a C. And C right here, we just call this a reversal of the curve or kyphosis. So in other words, her curve, if you will, goes like this, then it goes like this, and it goes like that. So we call that an S curve. The fulcrum of the curve that's in the reverse configuration, like there's a reversal of the curve right here, C1, C2, C3, C4, C5, C6. So at C5, C6, she has kyphosis. So in other words, her spinal cord is getting kinked right here. Now, for the spinal cord to go here, then go here, then go here, it actually has to travel 1 to 3 inches further. So that means her spinal cord is getting stretched. The spinal cord is getting stretched. So I can tell you right away, this patient, it's not just get prolotherapy. We have to help this person with her curve. And because the curve is reversed in her, the weight of the head is going to be way down here. So that would be like me, I'm all hunched over and I'm walking hunched over. Like if you're walking hunched over, obviously you're going to end up with back pain, knee pain. So in other words, the poor ligaments here, with the weight of the head being in front of the curve, they're just going to get stretched out. I mean, this is a no-win situation unless we restore her curve. And I'm sure once we see her scan, there's going to be all kinds of instability. And if you look here, it's just terrible. So if we go to C6s here, C5's here, so there's all that space here. C4, C5, that's the amount of instability that's there. C3, C4, C2, C3, and the instability is severe. So this person needs extensive amounts of prolotherapy in the neck along with eventual curve correction. But the prognosis for her is excellent. Prolotherapy is a series of sessions. Normally we would see a person every 4 to 6 weeks. When people come over from Europe, I'll often expedite the treatment where we might see them every week or every 2 weeks, because some people, they just have a limited amount of time, like 4 to 6 weeks to get treatment. So that's why we would hit them so hard, because there's nothing we can do about it, because they have jobs and they only have so much vacation time. But in the ideal situation, somebody would get treated every 4 to 6 weeks. And this is severe, extreme instability. It's terrible instability. So this particular person probably is going to need a year's worth of care. But again, the prognosis is good for resolution of the tinnitus, the vice-like feeling in the head, that her sensitivity to light, and all the other symptoms that she has.